What's up? Oh no! Did y'all hear me? I said, "What's up? What's going on, y'all?" Everybody should be home from work by now. Okay, that's the reason why I make it at 6 o'clock. But I do chats sporadic times. Y'all know that. But I'll try to make the chats for after you guys get off from work. Okay. Sometimes it doesn't work, but that's what we're gonna do. So, how's everybody this evening? Uh, so today, you guys know we talk about medical terminology today. I did get your schedule out for today. So some of y'all who just started, some of you who are not doing medical billing, and you just want a little bit of medical terminology to help you with your CPC or medical billing. Maybe you're working and you need to get a touch up on that. Okay, that's what we're doing. Okay, so you do need your language of medicine book. Okay, so remember that we do use that book. Why, Miss Lambert? Because you have to do your own homework. Okay, and you have to work in those books. And I'm going to answer emails today. And some of the emails was about revenue cycle management, and some of the emails were about my schedule and the course itself. So we were talking about the hours of the course. Well, we wasn't talking. Y'all sent me an email, but I'm going to answer them. I'm going to answer them through this chat. Okay. So let me just drop the schedule up there real quick because you guys didn't see the schedule. This is for medical terminology. Okay. This is this week. I didn't put the titles in there because I didn't think it was necessary, but I mean, you want me to put the titles in there, I'm going to drop them in there. But most of y'all should have your book. So you guys remember last Saturday we did chapter 1 and chapter 2. Monday we did 3 and 4, the suffix and prefix. Today is chapter 5 and 6. We are starting chapter 5 and 6, and chapter 5 and 6 is on 5 is the digestive system, medical terminology and the digestive system. Okay. That's what we're going today. That's where we're going. Chapter 6 is additional suffixes for the digestive system. Okay, so make sure you guys pay attention, write down what you need to write, and we can kind of get moving with this. Now, you guys can, I don't know, I think you can download from, from YouTube. I do that. I download from YouTube all the time. I don't know if you can, but if you can't, let me know. I'll send you a hard copy of this thing. Okay, because I want you guys to stay on track. So you guys can see YTU, you're getting a lot of what Sapphire Academy gets, but it's kind of hard for you to kind of make a file or anything like that. But send me an email. I'll go ahead and send it out to you. So Miss Lambert, how many hours is your course? So my traditional course, the Academy online course, has different programs. Okay. I thought I wrote it down. Has different program. I did before I show you that. Okay, hold on. So I'm answering the email. So Sapphire Academy, Sapphire Physician Coding Academy has 3 courses: an advanced course, a transitional course, okay, and a basic course. The advanced course has 300 hours. The transitional 200, the basic 150. Why, Miss Lambert? Because the advanced course has all subjects, all 21 points are in there. All subjects are in this course. Okay. All subjects are in this course. Everything that you see on my website, okay, is in this course. Okay. I'm going to show you the website later on, but you guys go on it. Go to the bookstore, Sapphire. What is it? Sapphire Coding. SapphireCoding.myshopify.com. Okay, y'all go ahead and go on that. That's the bookstore. That's where my courses are. But you can always go on SapphireCoding.com and click bookstore and you'll get in there. Whatever link leads you to the courses. Okay, so the advanced course has 2 courses. Has 2 programs. One is a part-time program. Okay, this is the syllabus. All right. Y'all can't see this. I'm going to take this down so y'all can see this. Y'all still can't see it. So this is the syllabus for the 300. All right. This is a 40-week course. Okay. It's 300 hours because this is part-time. So if you do about 15 hours a week, it's in there. See how I have it broken up? You can't really see it, but this is broken up into hours and theory. So if you do at least 15 hours a week, you should be able to get through that in 40 weeks. All right. That's 300 hours. Okay. That's one. Okay. I know I got enough stuff over here to get X, Y, Z. I don't know what that is. Get rid of that. It must be something I had. Okay. The full-time 300 hours, that's 30 hours a week, okay? That's my syllabus for full-time, okay? I'm not going through it, no, I just pulled it out so I can remind myself was it there, okay? All right. Now, this is your transitional program. This is my syllabus for transitional. This program is 16 weeks. It's 200 hours. All right. 16 weeks is 200 hours. Divide those hours up in 16 weeks. Okay. This is the basic program. That's my syllabus for the basic program. Okay. What's the basic program? 9 weeks is 150 hours. Ms. Lambert, well, what's the basic program? The basic program is medical billing only. It's medical billing only. Okay. Ms. Lambert, what's in the transitional program? Medical billing and medical terminology. Okay, that's what's in there. Okay, so, in that program, the 20-hour program, everything is in there. 40 hours, everything is in there. All right, so I'm expecting y'all to do everything. Okay, what? Oh, okay. So the transitional has medical terminology, medical billing, beginner ICD-10, and beginner CPT. The basic program has medical terminology. Oh, okay. I know. Medical terminology and billing. You see, I forgot. But anyway, I don't use these. I use, I'm always on E-line. But I just broke that down to y'all, okay? So the basic program is medical terminology, medical billing, okay? The transitional program is medical terminology, medical billing, ICD-10, and CPT. So this is for y'all who wanted to see my syllabus and a breakdown of the hours, okay? This is a breakdown of the hours, and I printed out all of my syllabuses, all right? So there's 3 programs in the Sapphire Academy. YTU, you get about 65% of this. This is Sapphire Academy. This is what they get. So we have the 3 courses, right? So I'm just breaking it down again. Okay. Advanced, transitional, and basic. Your advanced course is 300 hours. My full course is 300 hours. This is your syllabus. The syllabus has the hours broken down. Medical coding, 40 theory, 40 practice, 90 in all. 15 theory, 30 practice, 45 medical insurance billing. Medical terminology, 25 theory, 40 practice, 65. You see how I'm breaking this down like that? 25, 40, 65 medical terminology, 15, 30, 45 medical billing. So this is how it's broken. Remember I told y'all how accreditation coming in, they want to see everything broken down? Y'all know Ms. Lambert don't play with that. Every single one of my courses is broken down in theory and in practice. So the advanced course has 2 schedules. Why, Ms. Lambert? Because everybody can't do 30 hours a week. All right. This is the full-time schedule for people who want to do 300 hours. All right. So your full-time schedule for my full course should only take you 20 weeks. Okay. Why, Miss Lambert? How am I going to follow that, Miss Lambert? That's why I got this. Okay, this is your syllabus. This is your syllabus. Your hours are broken down like this. No, this is not on YouTube. I'm just kind of showing you this because I got an email in regards to my hours. So I don't remember who sent me the email, but this is what we're going through the hours. So that's 300 hours. So the other schedule for your 300 hours is a part-time schedule. Okay, so I have a part-time schedule also for those who still want to take that full 21 points. And that's you got to do it at least 30 hours a week. Okay, 30 hours a week. That will get you through. If you do 15 hours, that's 40 hours, 40 weeks. Okay. So I wrote it down on it. You guys can pretty much see it. We're talking about this one. This is a basic program. This program is 150 hours. What's in there, Miss Lambert? Medical terminology and medical insurance billing. This syllabus is specifically for that one. Okay. So the transitional 16 weeks. Okay, you could, make your hours how you want. This is for people who are already in the academy. They choose the program that they want to do. What was the next question? Ms. Lambert, if we take the basic program, can we transfer to? Yes, you can transfer to the 300 hours if you choose to. Okay, so if you feel like you could do that advanced class, no problem. Go ahead and transfer over, and you can do the advanced class. Okay. If you're already in the basic class, that's added to the advanced class. So the only thing is you just get a little extra work. That's it. You just get extra work because of the 150 hours. If some of you are not going to do medical insurance billing, I still encourage you to go ahead and take the medical insurance billing. Okay. Because you never know when you might need it. Okay, so those of you who are in the academy on the Sapphire portal, you have this. I just went in there and just kind of updated a little bit of the stuff. I updated also Corinne's email, y'all's administrator. So her email she actually has two. It's on the syllabus in case y'all need to get her. Okay, she takes care of all of y'all paperwork. Okay, so what was the other question? Miss Lambert, no, I'm looking at the emails. I'm just looking at what they said. When is registration for Academy? Registration is whatever you want to. If you enroll in the course today, it's really you just purchasing a course and you're automatically enrolled. You can start whenever you want to. I will get an email that you have purchased something from the bookstore. Once I get the email that you have purchased something from the bookstore, I will piggyback that and send you an email. Okay, you will get access to the Sapphire portal. You will get a Sapphire physician coding email, and you will have access to that portal. Check chat 19. I went over the Sapphire portal with you guys. Okay, so any questions on that? Those are the schedules. Okay, I'm gonna drop this one up here. So Sapphire Physician Coding Academy has 3 programs. Okay, we got 3 programs. That's your 3 programs. Okay, we just went over the syllabus. All right, this is your classes. Okay, and this is what we're doing today. Okay, we're on class 3. So I'm gonna take that down. So let me know if anybody have any questions on that. So our classes are broken down by theory, by practice, and hours. So everything is different. Okay, everything is different. Your advanced course has everything. If you go on the website or you go in the bookstore, everything is there. Okay, so you're ready to start. What we need to do, I need to show you all the book. Okay, hold on. I need to show you all the book. Which y'all know the book, but I always have to put this up here because I need to make sure that everybody is clear on what kind of books to get. Okay, we're not in the coding. Look at that revenue cycle management chat I did the other day. It was a lot of fun. We did medical terminology. We're not in step-by-step yet. We are here. Okay, this is the book you need for this course. This is the older one. That's fine. You can use that one. Okay, so that's your medical terminology book, Language of Medicine. So this is your medical terminology course. Okay, and this is actually your class 1, 2. This is your 3rd class. So it should be Sapphire, ED, CLS, MT, 3. Okay, I might have shortened that, but I make sure I put that on it so y'all can know where you're at. Okay, so we already did, I'm just backtracking. Y'all know I backtrack when I first come on. We did the suffixes. Okay. Let me let y'all take a look at that. I'm going to share my screen with that just so y'all can see that book. So let's go ahead and share screen for a few minutes. So you guys can see. So what I'm doing now is I'm just putting up what we did last week. Okay. Well, not last week, Monday. That's scheduled for this week. Okay, so we did chapter 3, the suffixes, right? So y'all should be finished with that, okay? And then y'all had the exercises to do. The exercises are in the book. So if you guys don't have the book, give yourself some time to go ahead and get the book, okay? So that was 3 that we worked on. So you had an introduction, you had to do combining forms, suffixes, you had terminology there. Okay, you also had practical applications and you had a test sheet, okay? You had tests in there, okay? Pretty much exercises that were in there. Now, why to you do not have the exercises that we have in Academy, but I'm expecting you to at least do the exercises that are already in the Language of Medicine book, okay? So this is 4. We did chapter 4. You guys remember when we did chapter 4? Okay, so again, you should be done with this. We're already on 5, and we're just kind of getting into the gusto of medical terminology. Okay, so you guys should be through with that, and we should be able to move on to 5. Let's get it loaded. Okay. So this is where we are. Okay, this is the book you should have. We're in the digestive system. Okay. Introduction, anatomy and physiology, vocabulary. We should be looking at terminology. There's a couple of pathology system issues in there. Pathologic conditions. All right. We ain't looking at that because that's going to be scary. Exercises and punctuation. All right. So you guys are probably archiving this. If you don't have your book, just kind of like follow along. And again, if you go on my website, sapphirecoding.com, or if you go to sapphirecoding.myshopify.com, you'll see the courses there. If you buy one course, let me know you have your interest into the class. Okay, and that book is free. It's in the classroom, and you can look at it as much as you want to. Okay. So let's kind of just get started and go through. We're already 17 minutes in. Any questions about the syllabus? Any question about revenue cycle? We'll talk about different types of leadership, but we talked about that in RCM. I told you guys I'm more of a transformational leadership. That's more of you make stars, okay? You don't make stars within yourself. You make other stars. So we're gonna talk about it on the RCM level. That's going to be a whole different chat, and I'm gonna make a different playlist for revenue cycle management. Okay, because that's us. Revenue cycle management is everybody. So I'm gonna go ahead and open this up. So introduction to chapter 6. Those of you who are archiving this, you should have your book, and we're talking about the digestive system. Now, remember, the digestive system that we're talking about is the same that's in all the other books. And in this Language of Medicine book, it is formatted the same way that your CPC book is formatted. It is formatted the same way that your step-by-step book will be formatted. So just remember, all of this will help you in your CPC. Your CPC is derived from everything that you are learning in this class, okay? So don't forget to subscribe. Do not forget to follow us in our chats. We are Monday, Friday, and Saturday at 6 o'clock. Okay, guys? So this is the digestive system, and it's pretty much just an introduction. So you guys should have your books. I'm just going to kind of show you some of what's in here. We know that the digestive system starts with what, guys? The mouth, okay? So if you don't have your book, just let me know. And we'll try to go ahead and get you in that classroom, but you are going to have to get one of those courses on sapphirecoding.com or on that Shopify website. Look below. I put a lot of links below, and also the ISBNs below for you guys. Okay, so this is just a screenshot. We're just kind of looking at this. So in this chapter, this is digestive chapter, there are also combining forms in here as well. And if you have a question on the CPC that says, where did the digestive system start? It starts in the mouth, okay? And here they're just kind of identifying what's in here, okay? The cheeks, hard plate, lips. And again, you are going to read this. You're going to read this. And I like this right here. You could fill this out as well, because this is part of your exercise. Okay, you could fill that out. Okay, that's your oral cavity. And this, I love this in these books. Look, that's why I love the ebook. Now, I know some of y'all don't like the ebook, but I love the ebook because it's so easy to kind of navigate through. But again, if you have the hard copy, that's fine. You can go ahead and put that on your own sheets, okay? So again, this is chapter 5, and we are talking about the digestive system. Here are the tonsils, masses of lymphatic tissue located in depressions of the mucous brains. Now, you guys can read this yourself. If you have something on your CPC, remember, that's the purpose of us doing medical terminology, because it's on your CPC. Okay, you're only going to have about maybe 9 questions on medical terminology, or maybe 5. But when you're coding, you need to know the language of medicine. Okay, the language of medicine is what? Medical terminology. So see this right here? They may ask you, does the molar teeth come before the premolar teeth? Or how many molar teeth are there? How many canine teeth do you have? You see what I'm saying? So you never know, what they're going to ask you on the CPT. Those type of questions that I literally just mentioned to you are type of things that they may have. Okay. So let's just scroll down a little bit. They're just showing you teeth. Those of you who have your books, I'm on page 135. They're showing you salivary glands. This is a good one. I got to show you guys this one. So this, you won't have an illustration like this on there, but they may ask you some of these questions. They may say, where's the trachea? They may say, where's the phonics, or between, like your nasal cavity and things like that. And this just gives you an idea of what is in this topic for digestive system. Okay. And it goes more deeper than that. It goes with, long intestine, small intestine. It's going to get deeper than that when you guys start reading your book. Okay. I like this picture better. Because look, I used to have trouble with this, trying to get my students to kind of get this clearly. You guys see this right here? That is the diaphragm. That is the diaphragm. This might be your question on the CPT. Where's the diaphragm? Under the what? Lung, over the what? The liver. Right? Stomach. All that's below. Your splenic fixture, hepatic fixture, spleen. You see your spleen way back there? Your epiglottis. So they might say, so it might be something on there to say, where's your epiglottis? Where's your spleen? Back of the stomach, something like that. So that's the kind of things, that we want to kind of look for. And again, this is here, these answers that they have on the side. You just kind of drop down. Stomach. Food passes from the esophagus into the stomach. What if that's a question? How does the food pass through? A, B, C, D on the CPC exam might say passes from the esophagus into the stomach. That's going to be one of your answers. So that's the reason why you definitely have to read this. Okay. And again, set yourself time. Set yourself time. This is the stomach. So if you have a question that says, what do we call the top of the stomach? What do we call the top of the stomach? I'm going to show you right now. Fundus. So what if there was a question on your CPC? And again, these are called open and closed questions, okay? And I see how this book has so many illustrations in there. This is how you learn when you look at pictures, okay? You look at pictures that help you to retain. And, again, you guys can also put this on your index cards, right? Pylorus, that's the bottom. The body. Again, we're talking about the digestive system, okay? I don't need to go all in, but we're going to talk about the bowel. All right. I like this book because they don't have like actual pictures in the digestive system where it's like so invasive. The bowels and all of that, it's all cartoon, so it's not so bad. So the large intestine. So answer me this. Another word for large intestine is what? Large bowel. You see how I mean those are like should she know? And it's like on your CPC exam, you need to show them that you have been through all of these books and when you get in there and take that exam, you will not be worried. You will not be scared. You'll do what you have to do. So let's go down the line and what's in that large intestine. Large intestine extends from the end of the ileum to the anus. Remember, I told y'all about that word that sounds like ileum. It is the same. Remember, it was different. Okay, just watch out for that. Okay, it has three main components: the cecum, the colon, and the rectum. The cecum is a pouch. I might be saying it wrong. It's a pouch, is cecum. On the right side that connects to the ileum and the ileocoel valve. That's the splinter valve. I don't use that word. I'll say splinter valve. Okay, you got your appendix, your colon, ascending colon, transverse colon, descending colon, sigmoid, rectum, and your colon and your anus. Okay, so we all big grown people in here, right? So don't get flinchy on me, okay, y'all? The large intestine receives fluid, waste. Okay, you have to read this. They're going to ask you this. Anybody ever wondered why in the world we have bile? What is bile for? What anybody can tell me what bile looks like? Is bile dangerous? If the mother has not delivered that baby yet and that baby passes, feces or anything like that, and it reacts to that bile, the baby can't swallow that. The baby can be harmed with that. Bile is like it's like a brownish type of color thing. Sometimes you ever notice if you anybody ever throw up and it just feels disgusting? It's not food. It's like a liquid like. That's kind of like what it is. Let's go back to it so y'all can see what it is. That's kind of like what it is. So if y'all got your book, take a look at that. Make sure y'all read this. This is y'all's homework, okay? This is your homework. So make sure that you take a look at that. Okay, the liver located in the right upper quadrant. On your CPC, I'm telling you right now, that may be an open and closed question. Where is the liver? Tell me where the liver is. In the upper right quadrant, Miss Lambert. Okay, what is RUQ? Right upper quadrant. Okay, that's the way they ask you on your test. Okay, let's do the bile thing. Fluid called bile. Bile contains cholesterol, fatty, bile acids. It just sounds disgusting to me. I'm telling you, it's almost like you can see it. But you guys know I watch a lot of shows that have medical in it and surgeries and especially the death shows when they die and they start doing the autopsies. I love that autopsy. That's going to be on your test. It's just possibility of what autopsy is. Okay, but I love those kind of shows, and that's the name of the show. I think it's Autopsy. I like when they do that show. Okay, so if the bile duct is blocked or the liver damaged and unable to excrete bilirubin, I can't say it, bilirubin into bile, the bilirubin remains in the bloodstream, cause jaundice, yellow discoloration of the skin. I can't read the whole thing. You guys have to do it, okay? It's only a certain amount we can read online. But the liver continuously releases bile, which then travels through the hepatic duct, cystic duct, okay? And what if CPC says, how does the bile flow through the body? Okay? Anybody ever had their gallbladder taken out? Listen, that is no joke, okay? You are in some kind of pain, okay? You guys see where it is? Oh, okay. Hold on. Let me put you back in. Let me put you back in real quick. See, make sure I want you guys to fill out all this. When you're doing your reading, make sure you do this. I got 60 seconds of this chapter. Hold on. Okay. So, and make sure you answer those questions. Okay. So again, we don't need to go down the whole line. I want y'all to look at the pancreas. We don't need to go down the whole line, but again, this is the digestive system, and I'm just touching bases on you, bases with you with it. You should have your book. I want you guys to try to get your book. Try to get your book. I don't remember what I named this class, but hopefully it's 3 because this is your 3rd class. The revenue cycle class that we had the other day has nothing to do with this class. That was just a revenue cycle management class. This is your medical terminology class, okay? So for your homework, okay, you have to do the exercises in here. Whatever exercises in here, that's what you're doing. So your 2 to 3 hours, this is your homework, okay? This is your homework. Here, let me put this schedule up for you so you guys can see that schedule. Where's the schedule? That's not it. All right, hold on. Let me get it up there. I didn't show y'all the schedule. Well, y'all know what the schedule is. We look at the schedule all the time. Hold on, let me get it. So in this class is 42 hours, okay? And the rest of that theory belongs to you. All right. So in this classroom, it should have been on the other one. What we do? Put it up twice? That's the other one. That ain't it. Hold on. It's this one. All right. So it's 21 classes here. All right. So this class is 7 weeks. I want you to make sure you split that time. Okay. So if you got 2 hours a day, okay, your 1 hour is with me. Okay. There are times when I do 2, but I want you to spend that 2 home, doing your practice, doing your retaining. Okay. Putting your words on cue cards, index cards. Okay. Put them in. So that 42 hours is right here, but that extra hour is that extra 53 that I want y'all to do. So YTU, you don't get that much that they get in academy, but you get just enough. Okay. So I want you to, make sure you do that homework. All right. I'm just trying to see something in here that you can look. Obstruction, stages of an appendicitis. I'm looking at it like, I'm gonna show it to y'all since I'm looking at it. But again, this is part of your homework. This is part of your homework. So this is your 2 hours when you are at home. Okay, I'm saying an hour or 2, but I want you guys to make sure you steadfast on that. Okay, so again, this chapter is pretty long. There's also some suffixes in here. Lot of medical terminology, and that's what this is called, medical terminology. Ascites. We know ascites is fluid. That's medical terminology. Paracentesis, that's medical terminology. Okay. Anorexia, that's medical terminology. Constipation, diarrhea. We're in the digestive system, so you're going to hear stuff like that, or like flatus. That type of stuff is in the digestive system. You'd be surprised when you see people's eyes and stuff like that. That's part of your digestive system. A lot of liquids and fluids that you have in your system, it is part of the digestive system. You'll be surprised. Jaundice, you see this? It's part of the digestive system because it's liquid and fluid in your body. That's why it's part of the digestive system. Okay. I can't show you that. Some stuff I can't show, but esophageal cancer, gastric cancer, it's all kinds of digestive system issues that one can have. Hernia, peptic ulcer. And in this book, it shows you all types of illustrations, and it actually shows you where these things are. What if you've seen your child do something and you want to know what it is? Where did that come from? What XYZ? What's a hernia? How did where's the, well, I told y'all where that died. That's going to be in the chest, that diaphragm. If you hurting up underneath that chest right there, where your bra is right there, and you hurting right there, that might be your diaphragm. Check it out. What if you have an inguinal hernia? Inguinal hernia is showing you right here. It's down below. You see what I'm saying? And a hiatal hernia, inguinal hernia, that's definitely might be on your chest. They might want you to know the differences between that. Ain't gonna be no pictures on your CPC, but they may want you to know that. Okay. Crohn's disease. Wow. Oh no, we ain't looking at that. hemorrhoids, dysentery, diverticulosis. I never could say that. Abnormal outpouching in the intestinal wall of the colon. They might ask you that. And I'm not saying ask you that in retrospective. That I'm saying ask you that as in what does it mean? Hemorrhoids, swollen, twisted, varicose veins in the rectal region. They may ask you. You may have multiple choice. They have pictures of this different things like that you're going to do when you go home. Okay. When you go home, you're already home. I mean, when you get ready to do your homework, okay? Ooh, that's a good one. Volvulus. Yeah, I want y'all to check that one out. I can't show you that one. It's a little bit too invasive. Okay, so let's move on. Now I'm gonna go on to y'all's next chapter, but I definitely want you guys to look at this ultrasound showing large gallstones. See, all of this medical terminology is what's going to help you. Okay. The reason we do the medical terminology because it's going to help you with your CPT, your CPC. I don't know why I'm so tongue twisted today. Okay. If you can get your book, if it's not ebook, if it's hard copy, that's fine. If you have your CPT book, I would look at both of those books in a whole because a lot of those codes that are in there, the description of the codes, you need to be able to decipher that language. Okay, it sounds so ironic, but you need to decipher that. I have a dictionary. I've been trying to bring it upstairs for a minute. It's this big. It's a medical dictionary. Tomorrow's class, I'm gonna have it. I do look at that. When I see words that I can't comprehend or whatever, and I have no idea how to say it. Y'all know I can't pronounce half of the stuff. So I have to have a dictionary. Yes, you can look on your search engine. That's fine. But y'all know me. I'm old school. Okay. So that's that chapter. I didn't go through the whole chapter, but your exercises are at the end. I'm just going to pop in here and show you these exercises. Your exercises will be at the end of that chapter. So yes, I want you to do those exercises. Sapphire Academy, you ought to do your exercises that are for Sapphire Academy, and you can do this if you want to. Sapphire Academy does not have to do the exercises that are actually in the book. They're extra exercises. I would recommend you do them, but I give you exercises already, right? So you don't have to, but it's extra work that you can do. Okay. So let's close out that digestive system. And now we're going to just take a look at the suffixes in the digestive system. So let me put you back in there. So here it is. So this is the chapter we are on. This is what you should be on. That's what you should be working on. Okay. This is your lecture. This is your theory. Okay. Theory is reading. Lecturing is me on this screen, right, y'all? So let me get in there. Okay. So same thing, introduction, terminology. This one is suffixes, laboratory tests, practical applications, same thing. Different concepts, same thing, different stuff. You have your introduction. And again, you have suffixes and meanings, ptosis. This one is spitting, it's Ptysis. Okay, Raffi, I can't even pronounce this, ptosis, Raffi, Rhea. And it won't, when you're doing your CPC, stenosis, it's difficult reading a half a word. But when you are looking at the full word with the prefix, root word, and the suffix and stuff in there, now you got the full word. How we're reading it like this, where I'm going Rhea and then there's a dash. Let me show you what I'm reading. Where there's a dash, that's right there. It's hard to read. I don't know about y'all. I ain't making no excuses, but it's hard to read. Okay. So let's just go down the line. All right. So again, let me drop this down just to introduction, suffix, terminology. Yeah, we did that already. And they also have some laboratory tests and clinical procedures also in this chapter. Okay. And don't forget, we're still in the digestive. Let me see. Yeah, we're still in the digestive system. They're just going a little bit more in depth in digestive system with the suffixes and digestive system terminology. And it is, digestive system is a large chapter. You got the trachea here. The esophagus communicates with the trachea. Okay. I can show you this picture really quick because it's just it's a cartoon. I don't like showing you the real pictures because they're a little bit rough. But when y'all go home, I expect you to look at them. Combination form, bucco, sec, cilio, chilio, cholange, cholistic, colon, denti, duodenum. Well, it's duoden, and duodenum is the whole thing. Gastroenteritis, enteritis, esophageal, gastrogingivostomy, combination forms, gingivectomy, avectomy as in to cut into. So again, you guys will have your book and you will be practicing these exercises. These are pretty much just, they want you to give the meaning. So don't forget, you can go to, again, elsevier.com and get those books. And you also can go on Amazon and get those books as well. As you know, Amazon, like I told you, they always have a special. Okay, that's elsevier.com. So that's where I want you to get those books from. You can get your ICD-10 book from Amazon or AMA. They're going to direct you to Amazon. Okay, or you can go to AAPC and get those books. I have to put a thing up for AAPC. Okay. So let's take that down. So let's go back. These are the exercises that you're going to do. And again, I want you to try to set some time for yourself so that you're able to retain what's in here. Again, chapter 6 is pretty much still the digestive system. It's just giving you stuff from laboratory and a little bit more suffixes, okay, to give you more of an idea of how these words are going to be put together on your exam. So remember, all this is for your CPC exam and for, if anybody is taking a test, medical billing, and they have medical terminology in there. Okay. All right. So the tests are a little bit, I don't know what I can say and what I can't say on here, but we're going to bypass those tests and just skip down the x-rays. Gastrointestinal x-ray, barium enema, okay, choleangiography, I can say those things, okay, x-ray examination of the biliary system, performed after injection of contrast into the bile duct. Upper gastrointestinal series, x-ray images of the esophagus, stomach, and small intestine obtained after administering barium by mouth, often performed immediately after an upper gastrointestinal series. A small bowel barium passes through. They just kind of show you what it is. A barium swallow is a study of the esophagus. And sometimes you might use that orange sweet stuff or you like that blue stuff. I don't know how many of you had it, but when you get your book, magnetic resonance choleangiography, that's on your test. You see this right here? I can't even pronounce it. This on your test. You see that word? Make sure you put that on an index card. So those of you who don't have your book, make sure you get your book. All right. So some of this stuff I can't show you, but a barium enema, we just pretty much went over some of what that was. The x-ray image of barium enema. Computer tomography. You guys know what that is. That's your CT, a series of x-ray images taken in multiple views. A CT CAT scan uses a circular array. Okay. Now, in your CPC, a lot of your codes will consist of, did the patient have a CAT scan or XYZ? And a lot of those codes are going to look the same. There's a code for computed tomography, which is CT. Okay. If it says CT on your test, they might say ABC. What is it? What does that mean? Okay, so you already have it right here. CT scan uses a circular array of X-ray beams. I think there's a couple of them, the CT and a couple of other different types of X-rays that were on that exam that might be in here. So they got the ultrasound in here, and what's the abbreviation? Ultrasound. The MRI, magnetic resonance imaging, magnetic waves produce images of organs and tissue in all three planes of the body. Now, you don't need to remember all that. You need to know what the MRI stands for and what it does. It's magnetic images, magnetic wave images. That's the kind of stuff that's going to be on your test. Okay, that's the kind of stuff that's going to be on your test. All right, so we can kind of keep going down. Okay, so those of you who are going to archive this, just make sure that you have index cards and write down what we're talking about. Bariatric surgery. Okay, procedures used to achieve weight loss in people with severe obesity. Okay, and this is a picture of it right here. They're just pretty much showing it to you. Okay, let's burn it up in here. I got to turn it on. Okay, so and guess what? Some of y'all, what if some of y'all want to know about this? What if some of y'all thinking about getting it, right? Read in your book, read up on it, you know, find you some pictures. You got plenty of pictures in here, and it's pretty much almost like you're studying and you're reading up on something that you might be interested in. Guess what? It might stick more, okay? Because they're going to have tests, they're going to have questions on that, depending if you get the digestive system. You might get a CPC exam that doesn't have the digestive system. You might get something on a CPC exam the first time that you won't get the second time. That's only if you fail the first time. But you understand what I'm saying? So, you know, something that you really, really interested in, I bet you study that. I bet you would study that. So, you know, sleeve gastrectomy, gastric bypass. First, the stomach is stapled so that it is reduced in size to a small pouch. Next, a shortened jejunum is brought up to connect with the smaller stomach pouch. Now, that's this one. Okay. Oh, let me see. Can y'all see that? Wait a minute. All right. So real quick. But when y'all get your book, I want y'all to look at that, okay? I mean, I don't know, I just can't imagine. But I'm saying I know people actually had it, you know, had this one, but the sleeve and the weight just came right back. Okay. I can't show that. Gastrointestinal endoscopy. Okay, so the basics is, you guys know this is what you're going to do for homework. You're going to do your 5 and your 6, okay? I want you to write down laparoscopy, okay? Write down a definition. Visual examination of the abdomen with the laparoscopic inserted through small incision in the abdomen, okay? Liver biopsy. I want that on the index cards, y'all. This is for practice for you. Removal of liver tissue for microscopic examination. Nasogastric intubation. Insertion of a tube through the nose into the stomach. Okay, paracentesis. All right, puncture to remove fluid from the abdomen. Okay, I'm going to show you right now what I'm talking about. Okay, so put them on index cards and use it to retain. Use that for your study. Okay, use that for your study. Colonoscopy case report. You don't have to do that one. Okay, this is just literally like a report that you're going to decipher. You're going to turn this into money. You're going to turn this into numbers. Okay, that's what they're telling you. Matter of fact, I will read it to you. A 60-year-old man. What if this is a case? What if see, I can't see. I'm looking at this page. What if this is a case? Okay, so I'm going to go ahead and read it. It's just like a case. I'm gonna show. I don't know if I can show you this. I'm gonna show you for a second. Okay, I'm gonna show you for 1 second. Okay, so that's a case. You see right there where it says case on your CPC. You will have little. This is, to me, this is a small case. This is a real tiny case. Okay, and I'm gonna kind of jot down some of what it is. I'm just gonna move it around, twist it around a little bit. 55-year-old woman with a history of multiple and prominent colon adenomyosis. Okay, with some areas of high-grade dysplasia. Underwent colonoscopy. The endoscopy was passed through the anus and advanced to the cecum, okay, however you want to pronounce it, 2 pedunculated polyps were found at the hepatic flexure. Pulpectomy was performed using a hot snare. That's like a scoop. Okay. Resection and retrieval were complete. Okay. From, they're just telling you where it came from. Weinstein, Hawke, clinical gastroenteritis. This is a real case. Okay. This is a real case. This is something that actually happened. But again, it's a, something just letting you know this is the type of thing that you will be deciphering. And if this is the digestive section on your CPC, you will only have the digestive section. They will give you things that you're going to talk about on that section. Let me just pop up. I'm going to go into AAPC real quick. Next time I'm going to download that thing, but it's actually in, I don't know if I can come up with it. It's actually in chat 13, y'all, but I still want y'all to see. Let me see if they still put that in there. I don't know if they still do it or not. They may not do it no more. They do it. It's going to take me a minute to find it. What I'm looking for is what they're going to have on the test. So it's usually in here, what they're going to have on there. But again, I think it's about 6 questions. 6 questions of medical terminology. All right, so I want y'all to navigate through AAPC so that I'm going to show y'all this right here, because look, I'm telling you, they use the same thing. I'm going to show y'all this right here. The reason I'm going to show you this is because this is really, like AAPC, they're using their ICD, stop the share. They're using their ICD-10 book, and they're basically, let me get it right there. Okay, so I'm gonna share my screen with you. I'm on AAPC, and I wanted y'all to see the type of things that they study. Okay, this is the type of stuff that they study. They study the same thing that we are studying right now. You see how that book is just flexible like that? And 9 times out of 10, it's the ICD-10 book. Let me see which book it is. I don't know which book it is, either ICD-10 or CPT, but it looks kind of thick, so it could be that one. This is AAPC website. We're just kind of looking at it, and they have a class too. I think their class is about $4,000 or something like that. But these are the people who made the exam. These are the people who made the exam. I mean, you taking that exam, you want to get as much as you need to so that you can pass that exam. Passing grades are 70 and higher. Okay. That ain't what I'm looking for. Y'all already know that. But look, I found what I was looking for. So let me see. So let me get back to you. So this is the AAPC, and they're going to have 4 questions on medical terminology. Now, just because they're going to have 4 questions on medical terminology does not mean that you not to do this language of medicine class, because this language of medicine class is teaching you how to decipher notes, okay? Teaching you how to understand what the doctor is writing, teaching you how to understand what the digestive system is, what oncology is, what OBGYN is doing, how is he delivering these babies, okay? So you have to learn language of medicine, even though we see that they're only going to have 4 questions. Okay, so this is the breakdown of it. Okay, and this is what they're specifically telling you what's going to be on there. Okay, now you might get something different. It says passing breakdown of 100 questions CPC exam. Passing the CPC exam requires you to correctly answer a minimum of 70 questions from the domains below. Right? Why I'm in because there's 1 point each question. So medical terminology is 4, anatomy 4, compliance and regulation. You have 3 questions. You can't get none wrong. Okay, look at it. We did this already. Coding guidelines. You're gonna have 7 questions. Remember, I told you about the coding guideline. ICD-10. You're gonna have 5 questions. This area will test your proficiency in diagnosis coding within all the chapters of ICD-10 CM. Did you hear them say all the chapters of ICD-10-CM? Okay, thank you. HCPC level 2. You still need to know HCPC. I don't care if it's 3 questions on there. Hit the whole book. When we get to that book, we're going page by page. Okay, so the 10,000 series. 10,000 series is 6 questions. That's integumentary system. The 20,000 series, 6 questions. That's your musculoskeletal system. 30,000 series, 6 questions. Cardiovascular system. 40,000 series, 6 questions. So what we're doing right now, there's going to be 6 questions. Okay, and they even give you a little bit of what you're going to go through, but you still have to go through the whole thing. Okay, the whole chapters, digestive system. Your knowledge of the 40,000 series CPT section covers surgical procedures performed on the digestive system, which will focus on these areas: lips, mouth, palate, and uvula, salivary glands, and ducts, pharynx, adenoids, and tonsils, esophagus. That's the whole thing: stomach, intestine, and appendix, rectum, anus, liver, biliary tract, pancreas, abdomen, and peritoneum and omentum. AAPC is not playing. Y'all go on the website and look at what I'm looking at, because when y'all register, don't forget you have to register, okay, before you can take the test. Okay, the 50,000 series is what? Urinary system, okay, reproductive system, male. Okay, 60,000 series, 6 questions. That's your nervous system, peripheral nervous system, radiology, 6 questions, pathology, laboratory, 6 questions, medicine, 6 questions, E&M, 6 questions, anesthesia, 4 questions. Okay, you have 10 cases, 10, 1 question each. Okay, I hope this is still on where y'all can see it. Oh, okay. So again, I let the time get away from me, but I had to show you that. Okay. So we did that. We did a whole thing in chapter 13. So take a look at chapter 13. So again, this is your digestive system. You will, I ain't showing you that. Okay. You will need to know some of these key words. Okay. Some of these key abbreviations: a barium enema, bowel movement, celiac disease, chronic idiopathic constipation, computed tomography, CT. I hate this one. Esophagogastroduodenoscopy. I can't even say it, but this is it. EGD. Okay, I'm on page 190. Those of you who are archiving this class. Okay, gallbladder, GERD, gastroesophageal reflux disease. Okay. I must have been better with these words when I was younger, because I'm telling you, me reading them out is a problem. I like this one, peptic ulcer. I don't like this one, PUD, peptic ulcer disease. Hello, first person narrative describing the symptoms and treatment of a woman with a gallbladder stones. No, we're not doing all that. Y'all are going to do that. We only have like 4 minutes to this class. But I want you guys, here's another case report. Oh, I love this. Look. If you guys want to kind of mess around even with the coding, if you got your books, mess around with this case. Oh, y'all can't see it. Okay, let me stop the share. I got to put something else in here. Wait a minute. Every time you change the channel, you got to change the share. Hold on, y'all. Hold on, doggone it. I got to show you. See, look, that's in the medical terminology book. I'm surprised. But again, that's the new book. 2025 is different than the old ones as far as adding stuff in there. Now, the medical terminology stuff is the same, but this is newly added in here. I've never seen this in the book before. That's a case. That's a true case. That's a true coding case that you can kind of mess around with, if you got your CPT books. Okay. I got 1.5 minutes left, so hold on. What caused the patient jaundice? I love this. Look. And see, this is why I like the ebooks. See, that's one of the questions. In the ebook, there's a drop down in there. You can choose the answer that you want. Okay. Let me go back in there. And there's 1, 2, 3, 4. So there's actually 4 pages of questions there. Here go your other exercises. Okay. These are the exercises that you guys are going to do in this book. That's your exercises. So when you hear me say, you guys have exercises to do, those are the exercises that I'm talking about. Okay, so this class is over. We've gone through 5 and 6. Generally, what you're going to do right now, we're already at the exercises, but we're not doing the exercises. You guys are going to do the exercises. I'll show them to you real quick. Okay, I know it's Friday night. Everybody doing their after work thing because I usually get more of y'all popping in and popping out. But you guys go ahead and archive this Saturday morning. I will not be here Saturday morning. I will be here in the afternoon. I have to go to work tomorrow. So Casablanca. I mean, que sera. I mean, adios. Look at this chat. Y'all look at this whole chat. Make sure y'all go on my website, sapphirecoding.com. Go to the bookstore and the courses. You can get the courses for $10. That's for y'all to work with this, okay? sapphirecoding.myshopify.com. Look down below. All of the ISBNs are down below for all of the books that we need to use. If you have missed anything on this, just all you have to do is rewind every time you want to hear me say something again. Okay, don't forget to check out those schedules if you want to, okay? So I'm going to go back and see what this is. I might change what's in the front of this chat, but again, you guys have a good Friday, and I'll see you guys tomorrow.